welcome to everybody who's just joining.
Mm-hmm. Well, while we do that waiting, I'll say, I'll extend something that Bob put in his email out, which is I'm very interested in people when we get to the discussion period and beyond. If you've got great examples of creation of social capital, when we were talking about stuff going on in the Netherlands, stuff going on in Singapore, first, we'd love to hear them as a group. But then I edit this publication, NEJM Catalyst. We would love to explore publishing on them and sharing them and making other people feel jealous and competitive and inspired. So think while I talk about, okay, what's an example that I can come up with, ideally from your own organization or from another organization that you know of that you might share that will inspire the rest of us to feel competitive and see if we can adapt.
And Tom, what a great invite. Just tell us another moment more about Catalyst, and I know it a bit, but how wonderful to have the editor here. What are you guys looking for? They strike me as they're quite short, they're quite punchy, they're quite exciting. Tell us a bit more about it.
Well, NEJM Catalyst, we are the online spin-off from the New England Journal of Medicine, where I've been an editor and editorial board member for a quarter century. But 11 years ago, we created Catalyst to try to actually accelerate progress toward a higher value healthcare system. Michael Porter and I were the co-heads of the editorial board, and I'm the editor-in-chief. It's completely a labor of love, completely uncompensated, but it is a labor of love. And so we're online and we run case studies, and some of you have written for Catalyst already, that are aimed at improving healthcare, safety, efficiency, quality, workforce resilience is, anything that was going to make care better. So we do case studies, like 1,000 to 2,000 words. We do in-depth articles, a framework for looking at complex topics. We've got a behind the paywall journal aspect, and then in front of the paywall commentaries and podcasts and web meetings. But we're about trying to improve healthcare. So for this group, knowing many members of the group, you can safely assume if it's interesting to you, it's going to be interesting to me and the team. So.
Tom, what a fantastic link. Listen, and as we've previously done some lovely stuff before as well, and James Mountford and Dom and I put a piece out with some opportunities around BMJ leader. I've been talking to Karen a little bit, who's on the call. I think there's an onus on all of us, isn't there, to write and share. What a great invitation. Right, Nikki, I think I'm lobbing the rugby ball a few tens of thousands of miles down to New Zealand. You're gonna kick us off on this, and I guess tell us a little bit about who this character Tom Lee is, and why you thought it'd be a great idea to invite him. And we're all super excited. And then I'll get ready with breakouts and things to follow. But listen, as Nikki says, do say hello in the chat if you haven't already. But Nikki, over to you.
Kia ora, everyone. Can you hear me? Kia ora. Hi, Tom. I'm very excited to have Tom with us. But actually, Bob, I'm going to leave it to James to introduce Tom, and I hope that's okay. But James did me the great privilege of introducing me to Tom a couple of months ago. And so I feel like that honour should be with James. For me, Tom, it's really exciting to have you here and to start to build some links between social capital and kindness. I think when you drill down, a lot of what you talk about with social capital can be accomplished with what we kind of conceptualise as kindness. So they're very much interrelated and interlinked. And can be put in a virtuous spiral together. But James, over to you. I think Tom should have the honour of his old friend introducing him.
Thanks, Nikki. Good afternoon, good morning, good evening, everybody. I'm James from London here. I'm sitting in a dark basement because I'm at home, and where I would usually take calls and things, I've been kicked out by my daughter and son who have a French lesson. So unlike Katie, they don't join this. They do their thing. But I'm going to introduce Tom by just telling a very quick story, and it's my first interaction with Tom. And I think I didn't think about it in terms of social capital at the time, but that absolutely sums it up. And here we are in 2024, and the story I'm going to tell is from probably November 2004, so 20 years ago. So I was lucky enough to do a Harkness Fellowship, and that takes you off to America from wherever you come from for a year. And I had my heart set on going to San Francisco. I can see Maureen smiling as well, because she has a similar part to play in this story. I never got to San Francisco, expect to visit Yosemite. I instead went to Boston, and I'm delighted I did. And a big part of that was getting Tom's email from the Commonwealth Fund, who organised the fellowship, along with 3 or 4 others, and saying, write to these people and tell them what you want to do, and they may well respond and can help you shape what you do. Think about technology differently then. So Blackberries were new. I had just got a Blackberry, and Tom clearly had a Blackberry, because I send the email, let's say at 3 o'clock in the afternoon. Tom replies at 3:02, and it reads as follows. And I still remember this. I haven't seen this email for 20 years, but I still remember it. It says, "Hi, James. Great to hear from you. I'm on a ski lift with my family in New Hampshire, but Laura copied can find us some time." And then what followed from there was Tom becoming a friend and a mentor and a colleague. And we've done various things together. I can see Nell from Prescani here as well. Hello, Nell. Great to have you here. But Tom, I think that little vignette is as good a one as I can think of for how you build social capital by connecting people in a way that's useful and sparky around purpose and ideas. So thank you for that. Thank you for your friendship, and thanks for coming today.
Okay, well, let me plunge right in, and I'll go to the share screen mode, and so you guys can see my slides, I take it. All right, so
Yeah.
what I'm really happy to have a chance to talk with you about this topic, and I'm hoping that I'm not going to be like suggesting you change your values, but I'm hoping to all put in front of you a framework for thinking how we can be more effective in bringing about change, how we can amplify our signals. One of the conversations I've been having with Nikki over the last couple of months is, can we get tough about kindness? And I don't think that they're a contradiction to be using those 2 words together. The line that I am using as I talk about social capital around the country a lot these days is I am hoping that every manager will see themselves as being the CFO for social capital for their part of the organization, and approach that work with the same intensity and discipline that the CFO brings to financial capital. The CFO wouldn't ignore if you were hemorrhaging money in some place. If you're the CFO for social capital, if someone that is working with you is not adhering to a behavioral norm, like teamwork that earns treating people with respect, teamwork, high reliability, then you can't ignore that either if you're the CFO equivalent. How do we get there? And I actually think to get there, it's going to take harnessing the power of social networks. We all have great social networks. This is a great social network that we're part of now. But I will be talking about 3 specific steps, which are building connections, strengthening connections, and transmitting the right values across those connections, and then having enforcement mechanisms so that if people don't adhere to them, we do something about it. So okay. So, let me just start by saying I am an optimist, and I do believe that as difficult as the last several years have been, we're actually deeper and wiser than we were a decade ago. And but we're deeper and wiser in ways that demand some new responses if we're going to react to in a constructive way to what we are recognizing. But like in 2013, not that long ago, I actually published an article in the New England Journal called "The Word That Shall Not Be Spoken," and it went kind of viral. Like the New York Times had a front page article about it with a big story in the inside, and they had a big follow-up article because Gina Colada, the reporter, was so struck by it. And the word that shall not be spoken was the word suffering. And what I wrote about was how it had, I was struck by, I was just joining Press Ganey, and the CEO had said, what we want the company to do is to help people reduce suffering. And I said to him, gosh, we don't use that word much where I work at Mass General Brigham. And then I went to the New England Journal for an editors meeting that day, and I mentioned that breakfast conversation, and all of the other editors agreed they didn't like the word suffering either. And what the head copy editor pointed out was that the New England Journal did not allow human beings to suffer in print. And when we asked her to explain what that meant, she pointed out that the AMA style guide is what you see in the bottom right-hand corner of what I reproduced there. All the good journals use the AMA style guide, and they explicitly say avoid the use of overly emotional terms such as suffering. So that the copy editors of the New England Journal were all trained that if someone wrote a sentence saying that where the subject was a human being and the verb was suffering, they should change it to, experience. So like the patient suffered complications, they would say the patient experienced complications. Organizations were allowed to suffer for lack of funding and lack of leadership, but people were not. And the reason was that, as one of my colleagues said, it makes you feel guilty. So I wrote this article about it, and it was an allusion to Harry Potter, and it got a lot of attention at the time, but it was like news that people were suffering. And 11 years later, I would say that everyone knows people are suffering. The New England Journal changed its policy so that people were allowed to suffer. But now we know it's not just patients, but it's the workforce as well as patients, and there are multiple nuances to the ways in which people suffer that we appreciate now. People in the workforce, in patients, they don't feel respected or included. They're afraid, even when they're not actually in danger. They feel afraid. They don't. We don't give hope as with high reliability, and people don't have trust. So these are challenges that we all know about, and I'm not going to go deeper into talking about them, but what do we do? Well, I think it's building social capital that has to be our response. It's going to be, I think we know what social capital looks like. I'm going to talk more about the term to give you guys some rigor to how you think about social capital. But, when we see groups of people behaving like teams, safety huddles, when we see, really managers being highly effective in rounding on the people reporting to them, not just talking to the 2 or 3 people they like, but talking to every one of them in the course of a week. The next point, colleagues saying yes to each other without needing to know the details. This is actually a really important standard. And that, my belief is that, none of us should relax until our team has that culture where people are going to say yes without needing to know the details. When I came to the Brigham and Women's Hospital for my internship, in the very first few days, another intern asked me to cover his patients for a couple hours while he ran out to sign his rental agreement. And I didn't know what was okay. And I asked my senior resident, Arnie Epstein, who many of you know, if it was okay. And Arnie said, sure. And then he goes, here at the Brigham, you never say no to a fellow intern. It's a norm. I have come to understand that norms like that are very valuable. And you don't say yes because you're altruistic and a good person. You don't say yes because you know you're going to get paid back or there's a good chance it'll be paid back by that person. You say yes because if the group has a norm like that, it leads to a series of actions that ultimately make the group better. It makes it faster, more nimble. And because you're a member of that group, you benefit. So that's an example of social capital. So that's why this middle section here is really important. Every person on this Zoom has lovely values, and they're in organizations with lovely values. But the next step is the tough one. You say, okay, how are we going to translate those values into behavioral norms? Behavioral norms that really everyone does. And if they don't do it, there are consequences of some kind. But if everyone does have those norms, there's improved performance. Now, I think a number of organizations around the country, and my colleagues and I are working with them on this, they're trying to make respect something like hand hygiene, where, hand hygiene was not so great not that long ago, but hand hygiene is pretty darn good today. People can't walk down the hall past a dispenser of Purell without putting their hands underneath it because otherwise they feel kind of bad. Can we get to the point where every patient and every person in the workforce feels they've been treated with respect? There are organizations actually really working on that now. Another example of a behavioral norm that I've been jealous of for a decade now, but it's a many decade tradition at Mayo Clinic that there's, their beepers or their beeper equivalents now that they're cell phones. There's one type of signal for a clinician calling a clinician about a patient. A doctor calling a doctor, a nurse calling a doctor about a patient with a fever or something like that. And the norm at Mayo Clinic is you answer those pages immediately. You don't finish driving to where you're going, you pull off the road. You don't finish a conversation or finish your lunch. You say, excuse me, a colleague is calling me about a patient, and you answer that immediately. The radiologists at Mayo Clinic don't recommend additional tests at the end of their readings. Every clinician here knows, you order an MRI and then you get a recommendation like do an MRA, that kind of thing. At Mayo Clinic, because they know you're going to answer your beeper immediately, the radiologist just pays you and they talk about what to do next. Now, when I first heard this, I just didn't believe it because it's so different. Like at the Brigham where I still practice, you answer your beeper if you feel like it. And the result is no one pages. They write emails and the emails get looked at midnight or the next day or maybe even not at all. It's better, clearly, if everyone has that norm. But when I was at Mayo Clinic, the first time sorry about that. The first time I went to Mayo Clinic, okay, I asked, and I found out it was real. And then I said, what happens if you don't do it? And I felt a little bit like the devil trying to tempt them. And they responded in that way. Like one of them said, the earth would open up and swallow you. Another said, you would be put out in the cold in the winter and you would die. And then a third said, you just don't want to have people saying he's the kind of person who doesn't answer his beeper. So, I bring up this example to make you a little jealous, but also to point out that norms need to have some kind of enforcement mechanism to really have oomph. And, it's never going to be a financial mechanism. It's going to be something social where you would feel really bad if other people said you're the kind of person who doesn't answer their beeper. Now, there's social capital for patients too, which I'll get to at the end if there's time. I may not have time, but all right. So this social capital stuff, I believe is hugely important on multiple levels at this time. And you know, I would allude in the big picture sense. I think that thinking about social capital, you know, starting with the work of Robert Putnam and Bowling Alone is, I think, the very best place to start. He really put this term on the radar screen for many, many people. Sociologist, you know, at the Harvard Kennedy School. I think a lot of you probably know this book, but for those of you who don't, the title refers to the fact that in the United States there are more people bowling than ever before, but bowling leagues have collapsed. You know, like the teams of the team from Dedham bowling against the team from Needham, that isn't happening anymore. People are bowling alone. Similarly, people are not participating in all sorts of other groups, parent-teacher associations. You know, not far from me, Tewksbury, Massachusetts, only four children turned out for the marching band this year. They've got 80 uniforms sitting in boxes for the marching band. So people are not participating, and there are many, many reasons for this, many drivers. You know, there's social media. The pandemic certainly did not help. There are things like air conditioning. Air conditioning, you know, in the old days, you would sit outside with your neighbors and talk in the summer evenings. Now we go inside where it's not humid and hot. And the way we shop. So I'm not going to, you know, talk about that social stuff, but I think we have to understand that we're in a context where, you know, isolation, there are many forces driving isolation. In healthcare, we really have those dynamics, you know, in spades. You know, and it's intensified by the fact that healthcare has become so complex because of all the advancements. There are so many more people involved. And as I put on the left, it's incredibly busy, but ironically, incredibly lonely. When there was less that we could do, we interacted more with each other. There are so many people involved. It's chaotic. You know, friction is the norm. There's so much data on every patient. People like those of us who are clinicians spend our day staring at computer screens, trying to take in information and react to it. And we're reacting as individuals as opposed to interacting and thinking in groups. Now, we can't reverse progress. We can't go back in time. I don't want to suggest everyone should still go down to the radiology room and look at films together and talk about them. We get more done now, but we're lonely and isolated, and we have to actually think, how do we work together to bring out the strength of groups and and counter some of the trends that are causing us to be so isolated. Now, so, you know, Brokerage and Closure, this book by Ronald Burt, he's a sociologist, and that's when I started to actually learn about what social capital really is. One of my daughters, who was a sociology major in college, she gave me this book. And so what I learned is that first, like, what is capital? Capital is anything that gives you an advantage over your competitors, an advantage over yourself. Like you want to be better in 2025 than you are now. But what is it that's going to enable you to improve? So this isn't like a financial, Machiavellian talk. This is about improvement. So, we all know what financial capital is. It's the money that helps you and your organization do things it couldn't otherwise do. Human capital are the people. Social capital is how those people interact with each other in their infrastructure that enables organizations to do things they couldn't otherwise do, like people at the Mayo Clinic answering their beeper right away. Another norm at the Mayo Clinic is no one looks at their smartphones anytime there's a patient around, because it gives a message, that we all understand, and it's not a good message. So there are currencies to social capital that we can measure and try to build: trust, teamwork, high reliability. But the big picture messages from Ronald Burt's work that I think are most valuable to take away, and I'm summarizing the big messages because this book is not fun to read. I'm not recommending you go out and get this book. It's kind of dense, but he has some brilliant points. One is that, social capital becomes really more valuable when the work you do and the organizational structures that you're working in are complex. If you're in a simple organization doing simple things, yeah, you got a boss, you got to please your boss, and you have to do those 5 things in order to please your boss. But when you're in a matrix environment and when the product that we're actually producing is really complex, then you need fuzzy relationship stuff to actually be effective. If you're just working by job descriptions, it's not going to go very well. The other point that comes out from his, well, he actually makes the point. Well, I'll get to another point of his shortly. But in this era that we're currently living in, where financial capital in healthcare is really constrained and human capital are really constrained, I think what that means is we have to be great on social capital. It is one of the few things we can really, really influence. I actually feel that social capital is more important than financial capital because you can get financial capital from the outside. You can beg and borrow, from the government, from some other source, but no one except you can create trust, teamwork, and high reliability. So, for people who are managers, boy, this is like it's your professional life is on the line in social capital. Now, what Bert points out is there are 2 basic ways to build social capital: brokerage and closure. That's where the title comes from. Brokerage is where you learn, you innovate, you increase variation within your organization by nurturing variation. Closure is the complement where you reduce variation by like nailing it down. This is the best practice. We're all going to do this way. We are all going to answer our beepers. We're all going to treat people with respect. And if you don't, then there are consequences. That creates social capital too. Now, I want to take a few slides, just 3, to sort of draw upon my collaborations with Michael Porter and what I learned from him to make the point that this is really strategic. This isn't about charity. This is like strategy for organizations to build social capital. But the beginning, the first of these 3 slides makes the point about, well, everyone's saying things are the hardest they've ever been. And the fact is, they really are more difficult than they've ever been before. But why? Why is that? So, and this is a conversation that I've had with Michael. I think many of you know, if you've had business training, that about Michael Porter's 5 forces. And this is what he described in 1979, early in his career. He talked about, the competitive threats for your financial margin. And whether you're for-profit, not-for-profit, everyone needs a financial margin in order to thrive and hire good people and invest for the future. But if you've got a financial margin, someone is coming after it and looking to take it away. And up until Porter's 5 forces, people mainly thought about the one in the middle, your existing competitors, the organizations that are like you. So if you're a hospital, other hospitals in the region, for example. But what Porter's first big contribution was pointing out that there are actually multiple other forms of threats to your margins, others competing for your margin. And they include if the purchasers have tremendous power and they can just tell you what they're going to pay, or if your suppliers have a stranglehold on you and they're going to say you've got to increase what you're paying for this or that, those are both threats to you. If new businesses like Amazon is entering your space, that's the one at the top, or if your customers can meet their needs in other ways, all of these are threats to you. And so what Michael feels, what I feel, is that the world has evolved in ways that the competitive threats, people coming after whatever the source of your margin is, are greater than they've ever been, and they are never going to go back to normal. The fact that so much of what we do is virtual, people can compete with you from anywhere in the world now. So, there are other dynamics intensifying the 5 forces. Consumerism. People are just, they're not going to just take it. We've got to, this is why we feel like things are so difficult, and we've got to accept that. Now, a second point that Michael Porter, and Michael Porter's famous for saying this, is strategy is the antidote to competition. Like, you cannot run away from the five forces. You cannot merge with everyone in sight to get away from that ball in the middle, because there'll still be the other four forces coming after you. So you can't leave the business just because there's a lot of competitive threats. You need strategy. And Michael and I wrote this article in 2015, 9 years ago now, about why strategy matters now. And it came up because really on a Sunday afternoon, I said to him, what do you mean when you say strategy is the antidote to competition? And then that led me to say, well, okay, what do you mean by strategy? Because I didn't go to business school. I was, I could ask him directly, and we wrote this article as a result. So in the article, we make the distinction between operational effectiveness and strategy, where operational effectiveness is doing what you do better and better, like hiring good people, adopting best practices, taking waste out of the system, taking errors out of the system. And that is 90% of what management is. If you don't have good operational effectiveness, you might as well go home, because you are not going to have a chance to thrive. But what we wrote about was that strategy is different. Strategy is making choices about what you're going to do. We don't like making choices in healthcare. When you make choices, you make people mad, and we tend to be kind of nice, and we don't like the tension. But if you can't make choices in an era where there's tremendous competitive threat, then you're at a real disadvantage. And you don't want to make those choices based upon politics or even what makes the most money under the current reimbursement system. What we wrote was that strategy boils down to two simple questions that should guide your choices. What value are you creating for whom? And then how you're going to be different. Now, Michael and I wrote another article in 2013, the strategy that will fix healthcare, and this is the figure from it on the right. And basically, I only bring it up to say that the takeaway message is that the best source of sustainable competitive differentiation is social capital, how you're organized. You can't try to differentiate from your competition on the basis of financial capital, and you can't even do it on the basis of human capital. Even though places like the Brigham and Mass General, where I spent most of my career, we think that what makes us different is we have great people. Everyone's got great people. It's how those people work together that really differentiates things. Now, this framework that we published, there's no data to suggest it works or it's of any value. There's no experimental data. It's just two people sitting around on a Sunday afternoon saying what we thought. And you can see I made this PowerPoint slide. I didn't quite get the arrows to touch the balls. I kind of gave up after a while. The takeaway messages, though, are what you see on the left. Great teamwork, measuring what matters, incentives for improvement, including transparency, improving care across journeys, not just during transactions, high reliability systems, the data infrastructure, and so on. So our belief is that to respond to the things making life so challenging these days, building social capital is what we have to do. Now, let me show you a little bit of data. I'm going to be very quick here because I got a ton of data, I just want to let you know that I'm not just saying this stuff. There's evidence for it. This is a proof of concept that there is such a thing as social capital. There's not a bunch of siloed tasks like patient experience and workforce engagement. When we divide U.S. healthcare institutions into quartiles based upon how the workforce expresses agreement on a 1 to 5 scale with the statement, this organization treats me with respect. And then we look at how patients' overall rating of their care and their likelihood to recommend, you see the correlation. We have so much data that shows the same kind of thing. Good things correlate with good things in the human experience. There is such a thing as excellence. And if we work to build really real excellence in the way people work together, it leads to better performance in every important way. We never find any tension where like, oh, if you do this, you're actually going to raise your costs in ways that that cause financial problems for you. You perform better. But this means you got to get tough-minded about improvement of things like respect and engagement and so on. I'm going to skip, I'm just going to say this, that when we look at like, this is 1 million employees, 1 to 5 scale, their engagement, 6 statements that capture how proud they are to be part of this organization doing what they do. And if you divide them into halves based upon how they score on their safety culture, which I think everyone here is familiar with safety culture measurement, it separates people into groups that are in the 97th percentile or the 2nd percentile in terms of their engagement. So like the safety culture, dictates, is a huge drive. You cannot have a strong safety culture. You can't have good workforce engagement without strong safety. This just says diversity, equity, inclusion correlates with workforce staying with you. This is down at the patient care unit level. So if people don't feel respected and included, you're not going to be able to retain them. So we have many, many things like this. But this one, I actually find both frightening and exhilarating. And I think, this is looking at employee engagement. Again, like we do several 100,000 employees per year across the U.S. on a 1 to 5 scale. They're rolled up scores for 6 different measures rolled together. And you see year by year. And each year is the data from the previous 12 months. So where it says 2024, that's really 2023 data. But the white numbers in the middle are the medians. And you can see that when COVID really sunk in, engagement went down. The workforce was taking a beating. But the numbers, the top and bottom, are the 10th and the 90th percentile. And what you can see is that the 90th percentile, it never went down. 4.3 went to 4.41, 4.35, and up and up. And then the strong actually got stronger. The rich got richer when it came to, how the workforce was in social capital. But for the poor got poorer. The bottom fell out for the people in the 10th percentile, 3.85 down to 3.65. The spreading of the pack was the rich getting richer and the poor getting poorer in social capital. You want to be in the rich getting richer group. Okay, now I'm going to accelerate here. I'm going to skip over this data that we have on workforce trust but let me just show you this. Just so we have a ton of data. So like when we look at, again, this is across, like in this case, it's 410,000 employees in all different job types. What drives their likelihood of staying with the organization or their likelihood of looking around if they're offered another job? You can see it's things like pride and respect, pride in the organization's commitment to quality, the teamwork. If this slide were 4 times as big and I put all the variables in, at the very, very bottom, the bottom 2 risk factors for losing people are compensation and adequacy of staffing. They're 1.6 and 1.4 as risk factors. Yes, we got to pay people fairly and we've got to staff fairly to be competitive and to do the right thing. But in terms of what actually dictates whether people are going to stay with us, our competitive differentiators are not going to be pay. They should be things like how proud they are, how respected they feel, basically social capital. All right, so how do we build social capital? I've got a book coming out in January, Social Capital in Healthcare. I didn't invent any of these ideas. I draw upon the ideas from other folks. I'm a broker. I'm not a genius creating these things. And so the books I drew upon very heavily include Bowling Alone, Brokerage and Closure, Nick Christakis' book Connected, Team of Teams, and then regular member of your group, Amy Edmondson's book on teaming. I'm delighted that on the cover of my book, Amy's got a blurb at the very top. So this is very much consistent with the with the information we've discussed in this group before. I'm going to just quickly say 6 quick insights and then open it up for discussion. The first is, as I said at the beginning, there are 3 basic functions that I would be suggesting you break your work down to. The figure on the right is Nicholas Christakis' figure of a social network. This is from his famous New England Journal paper showing that obesity spreads from person to person in the same way as infectious disease spreads. And that's because even if a friend of a friend of yours gains weight, you are more likely to gain weight, even if you do not know that friend of a friend. And that's because norms are developing around us all the time, even they're invisible to us, but we feel it and we respond. So what this means is that a big part of our work is building connections so that norms can spread, and then strengthening those connections so that people really don't want to lose their membership in the group, and it means something to them. And I'm gonna allude a little bit more to that in a second. And then the third thing is making sure you're transmitting the right values across those connections. Because as Nicholas points out, social networks are agnostic. They amplify signals. They can amplify bad signals like racism and anti-Semitism. They can spread rumors like people are eating cats and dogs and that kind of thing. But they can spread good values too. And his research has shown that they can spread altruism. They can spread a culture of respect, for example, and high reliability. So insight 2 is related to those connections, and this may be my most important slide in terms of the takeaways. James bringing up the how he knows me, that is important because, our relationship means something to each other. Neither of us would ever want to lose that relationship. We wouldn't want to disappoint each other. And you need connections like that in order to unleash the power of social networks. You cannot have connections like that in an organization if people aren't treated with respect. If people don't feel like they're respected and included, they can say, okay, we have a norm here of how we do things, and they can just say, yeah, okay, that's lovely. I don't care. You want them to feel proud to be part of the organization because they don't want to lose their relationship, you want bi-directional trust. Now, to do that, it takes managers functioning like managers, like really rounding to make sure every employee feels like they belong. Like in any group of 10 people, there are people who are confident they're insiders, and there are people who feel like they're on the outside. You don't want anyone feeling like they're on the outside. You want to be nice, but you also want the norms to be effective. So like one best practice that I recommend, I learned from other people, is that, you should round on 2 of the people reporting to you every shift, every day. And you should keep going around, not just keep talking to the same 2 people you like. And you should do audits. There was a lovely little article in Harvard Business Review that suggested on every Friday, managers should look at their spreadsheet, an Excel spreadsheet with the names of the people they're reporting to them, and give yes, no answers to 3 questions. Like, did you interact with the person this week? Did you interact with them around the goals, the performance goals that are important for the group? Did you interact with them about something important to them personally, including their professional development? And if the answer is no for any of them for like 2-3 weeks in a row, well, you're not doing your job. You have to do that. There's reciprocity, this business about I'm never going to say no to one of my colleagues, making that one of the things that characterize your group. Transitivity strengthens networks. Like Stanford, they're now having doctors come to retreats, but they're now having some of them bring your spouse or your partner, because Tate Shanafeld, who many of us know from his work on burnout, he's leading this. They figured out that when the people at home also feel good, they know each other, it makes the norms of the group that much more powerful. Then there are two types of connections which every manager should take responsibility for becoming strong at: bridging connections and bonding connections. And the distinction is important because a lot of us are happiest doing one and not the other, and we have to do both. Bridging connections are when you have interactions across groups, and that sort of broadens your identity, broadens the group identity. It accelerates learning. This is a bridging connection group that we have here meeting on Thursday afternoons. And, it's thin trust, trust, with people that, you may never have actually met before. You may never meet. Like Nikki is someone who I've never met in person, but I think she and I know anything she says, I will believe, and vice versa. Building that kind of connection. One of the things Ronald Burt points out is that people who build bridging connections as managers, they flourish professionally. They make more money. They get promoted faster. They are seen as smarter. And that's because they're bringing ideas from one place to another. At the same time, the complement, the closure that Ronald Burt talks about is like nailing it down within a group, super glue. That's what Robert Putnam calls this kind of work. It's the high reliability functionality, the psychological safety, the thick trust with the people that you see every day. Managers have to do both. You can't just be great at like building a tight team and feel like the bridging stuff is not your job. The teamwork stuff, I only put this up here to say, think about 3 different types of teamwork building: building great teams, building teams of teams, the teaming work. There's obviously overlap, but we need all 3 of those functionalities. And then the last thing I'll say about these insights is patients need social capital too, and there's a rich set of things to comment about that, but I want to quickly get to the end so we can have some discussion and comments. I do want to say that I'm drawing upon my Chinese culture. Maureen just came back from Asia, so she probably was around people that would relate to this. I actually feel like the habits that the behavioral norms, that work can be advanced with insights from Confucius. And I think he's a philosopher who lived 3,000 years ago or a little bit less. And philosophy is about how do you become good, how do you try to get better. And Western philosophy tends to emphasize rules, like you should never lie, even if it would save someone's life. And I respect that work, but at the same time, Confucius probably would have said, I don't know about that. Life is complicated, and it's hard to come up with a rule that actually works in every situation. And you don't want to have rules that people break when they feel like it. What Confucius believed in was the power of rituals. And this is where I think behavioral norms are like rituals. And frequent, regularly occurring events at which we behave as if we are the way we should be. So like an older person walks in the room, you stand up as if you're respectful. A patient is lying in a bed, you sit down as if you're respectful. You greet colleagues by name as if you respect them. You say thank you when someone has done something like clean the room, as if you're grateful. What Confucius believed is that if we behave as if we are the way we should be at these frequent events, it will hone our instincts. So in the big gray zones that make up life, we are more likely to have instincts that guide us to being more the way we want to be, the way we should be. So that if we have norms, behavioral norms, rituals, where we behave as if we're respectful, we're more likely to actually be respectful. So like after I started thinking about this stuff, like I see patients once a week. Tomorrow morning, Friday morning, I'll be going in to see patients. I no longer walk in looking at my phone, thinking about what I have to do to get through my session and get out to meet for my lunch appointment. I make sure I say hello to every single person in my little practice area by name. And they actually say hello back to me by name. And I say thank you to them now. these are things that I would be encouraging you to say, this is what I mean when I talk to Nikki about, can we get tough about being kind? Can we create norms, behavioral norms about kindness, and then really enforce them so that it feels like Mayo Clinic's, like the earth might swallow you up if you do, like you violate the norm. So I'm encouraging people to be like CFOs for social capital, strengthen the connections among the nodes of your network, choose and then spread the norms that will help you perform, and then act like a CFO. Measure, prioritize opportunities for improvement, create plans, and then monitor progress and act upon it. So with that, let me stop sharing, and I would love to hear your responses. I'd love to hear your ideas of great examples of social capital, and I hope I think my email, many of you know, thomas.lee@pressganey.com. Email with ideas that you might like to explore publication of, but make me jealous with examples of social capital that you guys have.
Tom, that was absolutely amazing. I'm sure Nikki and others could come in. Huge amounts. We're not going to go to breakouts. We've got a mere 9 minutes to go. Karen is speedily out of the block. And Karen, listen, you've also, on the business of linking people up, I sent your little flyer around, but why don't you do 10 seconds on that? And I'm sure you've got a comment or question for Tom as well.
Oh, just one. I have 10, but I'm going to ask only one. So thank you for putting the plug out with the flyer. So just as a kind of verbal reminder of that. So on the 28th of November, so in 2 months, and it'll be the week after the November forum meeting. So I can make a quick pitch there too, just as a reminder. But we will have at 4 p.m. UK time, that will be 11 a.m. East Coast time for those that are joining from North America. I can't do the quick math on New Zealand time, but just to say, we will be having a virtual forum on patient shaming and how we inadvertently use patient shaming in our toolbox to motivate patients. So the title is The Hidden Shame, Understanding and Addressing the Consequences of Patient Shaming. But we have a patient speaker, we have someone doing research on shame, and then a colleague of mine who also will talk about how they've changed their practice with this issue in mind. So please do join. My question for that incredibly stimulating talk that I took tons of notes for is, do you have any suggestions for if we're on the job market? Because you did mention there's a lot of movement, and I haven't seen that slow down. But if we're on the job market and we're interviewing at a place, is there a way that we can ascertain something about the culture of that workplace when we're on our 1 day of visitation, so not a lot of time? Or is there a specific question we can ask without being too provocative, but can get at the question of how important or how developed is social capital within that particular institution? Because sometimes you don't know until you're there. So is there a way to do some pre-work on this? Thank you.
Well, I think it's a really good and important question. And like my oldest daughter, who's, just finished her Brigham cardiology fellowship, she had me, talking at dinner with a bunch of her fellows, and they were asking me, what should they look for and where they go to work? And what I ended up saying is I would look at two things. I would like try to assess the social capital of the organization, and I would look at how are they responding to AI. And and then there's a relationship to them. But I do think that like organizations' ability to implement AI and take advantage of it and learn and fail quickly and adapt, that's going to be a huge competitive. You want to be at a place that is moving quickly to adapt, like ambient listening to develop your progress notes and so on. You don't want to be an organization that is going to do that 3 years after everyone else does. But in terms of assessing social capital, well, Nell Buellman and I wrote an article in Harvard Business Review about how do you measure it? What's a report card look like for social capital? I don't know that organizations are going to be publishing their data on this, but the data are there in many of the places about how do people feel about the culture of respect. It would be lovely if they would share it with you. We are advocating for, sharing that data with boards. Sharing it with prospective employees might be a little challenging, but the data are there. I would be looking for, trying to get your feeling for, do they have a culture where people feel like they're treated with respect? Do they have great teamwork? Is it valued or not? How, the safety culture stuff really correlates extremely strongly with all the other things we're interested in. So I would be saying, I think this stuff is going to be more important than compensation and benefits, and in terms of how you feel being in a place. Lisette.
Fantastic. Well done, Tom. Lisette, come on in.
Thank you. Hello, Thomas. Lisa Chavarria here in Texas. Mission accomplished. You made me jealous about those organizations that already have this social capital. And I might not make you jealous, but coming from an outside organization, I'm in my job. I'm still within my first 90 days. And I'm working on culture of safety. I'm the program director of culture of safety for a pediatric hospital. And coming from the outside, I've been terrified of the learning curve, steep. How can I make it to flatten it a little bit? And experiencing this, I've said this before to this group, but I experienced this epistemological change in my positionality. And now I see myself as a qualitative researcher. How having conversations, that's what I've been doing in this last 6 weeks. I'm having conversations with anyone who wants to talk with me about their perceptions and the culture of safety for this organization, so I can gather that information and not only use the results for the surveys that have been implemented before, but to really understand what's inside those minds and hearts, because that's the thing that I'm completely confident will really help us and any other organization to transform the culture. Now I know it has a name. What I'm doing, I'm building up my social capital.
Well, and then I think, you're hearing, what we're trying to do is not make people better. We're trying to make them highly reliable about being at their best, and then have them interacting with people that in a way that reinforces that. And it's all good, great work to do. I do think that step of like, okay, then what are we going to make the norm, and how do we make the norm, have power? That's where, like, the frontline managers, they shape the microculture. I do think, I know we're going to run out of time, because I went a little, I love the story so much, I went too long. But I will say that there is great stuff everywhere. I mean, another thing that Confucius said, one of his famous sayings is, if there are 3 people on the street in front of you, 2 of them could be your master, which is that, you've got something to learn from virtually everyone if you open yourself up to it. So I'm sure at every one of your institutions, you have stuff going on that would make me, seethe with jealousy. And I think jealousy is a great thing.
It is great.
Yeah, in Boston, it is the biggest incentive out there. Most effective driver. So I'm hoping that you'll come up with other things which will make me jealous. Even you don't have to send a full-blown case report. Even like an email thing, tell me things that make me jealous, so then I can go to other places and say, in Texas, they're doing this. What institution are you at?
I'm at Children's Health in Dallas.
Okay, so like in Texas, you're in Children's Health in Dallas. Okay, all right. No, they actually work very closely with my colleagues, and they're doing some terrific things. So you're in a great place. But anyway, Bob, I've come right up to the time limits.
One of the things I love, I think we're on about 50 of these. We're slightly lost count, but one of the tricks we do is we always leave people wanting more, and we're really brutal on the hour. In 50 sessions, Maureen, I've never felt more brutal, like going, because you've got us all thinking. And Lisette, I loved your piece there about mind and about hearts. And I think the encouragement that I'd give to everybody is, this is stuff to go and experiment with. This is stuff to go and spend the rest of our lives trying to work out different ways to build. And exactly as Tom says, create some FOMO, use that jealousy drive. I'm interested in which other, is Boston the city in the world where that's the most effective lever? I don't know. There's another area. I'm going to explore that one with you, Tom. Listen, just to say a huge thank you. If those of you who are not on the chat or haven't had a good look, there are at least 4 or 5 fantastic adverts around. I think one of them is a sort of in-person bit, but there's a whole load of these that are things you can get on at Zoom. They're at sociable times of day, possibly even for you wonderful people in the Southern Hemisphere. So do get in touch. There's a podcast up there from Jill, who's done a brilliant link into parent blaming. There's just a really amazing set of resources. Tom, social capital in an hour is never likely to come to a nice hit the buffers end. You've set us all thinking in the most beautiful way. Massive thank you. And let's keep that conversation live. I, for one, am gonna try and send you some stuff that will get you excited on that front.
Yes. Make me jealous.
Now listen, Nikki still around? I want Nikki to say 30 seconds about October, because I think there is a wonderful chap called Tom Geraghty joining us in October, if I've got things right. Is Nikki still there and able to talk? If not, I've just done the advert.
Hello, everybody. Can you hear me?
We can hear you, Nikki. Yeah, come on in.
Okay. So yes, October is going to be a really exciting session. We're going to build some more on what we learned with Amy with psychological safety, and we've got Tom Geraghty coming to us, who heads up psychological safety. I think it's .co.uk or .org.uk. If you haven't seen his website, you should Google him. The website's absolutely chocker with amazing resources for organisations and individuals. So yes, we will look forward to seeing you all in a month. And Tom, I put it in the chat, but I'm feeling very grateful that it's early morning here in New Zealand and I've got all day to ponder what you've shared with us today. I don't think there'd be any sleep for me right now.
Fantastic. Listen, thanks everybody. We have recorded it as ever. We will try. We're a little bit behind on getting the recordings up and the notes up, which mainly sits with me. So we will sort of try and pick that up, do a bit of a sort out. Thank you to Tom in particular, Nikki and James for teeing that up so beautifully, and thanks to all of you for joining as ever. So much to learn, so much to do. Have a lovely evening or day. Take care now.